PIONEER-HCM showed us that mavacamtem improved patients' symptoms, reduced LVOT obstruction, improved patients' ability to exercise, essentially improving myocardial efficiency in these patients with obstructive HCM. PIONEER open label extension, a portion of those patients who were able, we targeted a specific plasma dose for individual patients. And that kind of dose range was what we thought would be effective based on the PIONEER-HCM study. So number one, it was a targeted dose, targeted plasma concentration, in fact, in these individuals. And we show that mavacamtem is obviously safe and well tolerated in individuals for up to a year. And in some patients we've got on study now for more than a year and a half. So number one, it's safe and well tolerated. And number two is that it is highly effective at achieving what we want, which is to reduce the LVOT obstruction to what we consider below the surgical threshold. Secondly, it actually seems to impact cardiac remodeling advantageously. So what we start to see after 12, 24, 36, and now 48 weeks is that the heart is starting to reshape itself into a more normal looking heart. And that's manifest by a reduced left atrial volume. So the atrium is actually getting smaller, which is a good thing. Secondly, we see that the measurements that we use in order to kind of gauge the left ventricular filling pressures are returning towards normal. So that's your E prime velocity and your E over E prime, which is a well-known marker of left ventricular filling pressures using echo. And your NT-proBNP, which is a plasma marker for a similar concept, actually is tremendously reduced. And then the last thing that we see in the PIONEER open label extension is a reduction in left ventricular wall thickness in the septum. Now it's important to understand that there are only 13 patients that have been on this therapy for the period of time that I'm talking about. And echocardiography is not the most precise tool for measuring wall thickness. And the third caveat is that echocardiography that we did in this study, which was read by a core lab in Boston, they just used the standard American Society of Echocardiography measurements. But it seems like the wall thickness in the septum, which is where the majority of hypertrophy is in these patients, is starting to become reduced by about 1 millimeter or so.